Hello and welcome. Today we're diving into a relatively rare but significant condition, congenital cholesteatoma. This isn't your everyday ear infection, it's a unique growth in the middle ear that can have serious implications if left untreated. Join us as we explore its causes, symptoms, diagnosis, treatment, and what the future holds for those affected by this condition. So, what exactly causes a congenital cholesteatoma? Unlike acquired cholesteatomas which develop from ear infections or eustachian tube dysfunction, congenital cholesteatomas arise from embryonic tissue that gets trapped behind the eardrum during development. Think of it as a cellular remnant, a small collection of cells that shouldn't be there. It's not caused by anything the mother did during pregnancy, it's simply a developmental anomaly. Researchers believe specific genes or genetic pathways might play a role, but the exact mechanism is still being investigated. The key to understanding the danger of a congenital cholesteatoma lies in its pathophysiology. This trapped pocket of skin cells begins to accumulate keratin, a protein found in skin and hair. As more keratin builds up, it forms a growing mass within the middle ear. This mass, the cholesteatoma, isn't cancerous, but it's destructive. As it expands, it can erode the delicate bones of the middle ear, the ossicles, leading to hearing loss. It can also damage other structures in the middle ear, including the facial nerve which controls facial movement, and even extend into the inner ear or the brain if left untreated. Congenital cholesteatoma is considered a rare condition. While precise numbers are difficult to pinpoint due to variations in diagnostic criteria and reporting, it's estimated to occur in approximately 1 in 12,000 to 50,000 births. It accounts for a small percentage of all cholesteatoma cases, with acquired cholesteatomas being much more common. It typically presents in childhood, often between the ages of 2 and 5, though it can be diagnosed later in life as well. The signs and symptoms of congenital cholesteatoma can be subtle initially, but they often become more apparent as the growth progresses. One of the first indicators is often hearing loss in the affected ear. This may be accompanied by ear fullness or pressure. As the cholesteatoma grows, it can lead to chronic ear discharge, which may be full-smelling. In more advanced cases, patients might experience dizziness, facial paralysis, or even signs of intracranial complications if the cholesteatoma erodes through the skull base. It's important to note that symptoms can vary depending on the size and location of the cholesteatoma. Diagnosing congenital cholesteatoma requires a thorough examination by an otolaryngologist, an ear, nose, and throat specialist. The doctor will use an otoscope to visualize the eardrum and middle ear. Often, a small, white mass can be seen behind an intact eardrum. A hearing test, or audiogram, is crucial to assess the degree of hearing loss. Imaging studies, such as a CT scan or MRI, are essential to determine the size and extent of the cholesteatoma and to rule out any involvement of surrounding structures. These imaging techniques allow the doctor to visualize the cholesteatoma in 3 dimensions, helping to plan the surgical approach. While there isn't a universally accepted classification system specifically for congenital cholesteatomas, they are often described based on their location within the middle ear. Some common locations include the anterosuperior quadrant, the posterosuperior quadrant, and the sinus tympani. Identifying the location helps surgeons determine the best surgical approach for removal. The stage of the cholesteatoma, based on its size and involvement of surrounding structures, also influences treatment decisions. The primary treatment for congenital cholesteatoma is surgical removal. The goal of surgery is to completely remove the cholesteatoma while preserving or restoring hearing function and minimizing the risk of complications. There are several surgical approaches, including tympanoplasty, mastoidectomy, or a combination of both. The specific approach will depend on the size and location of the cholesteatoma. After surgery, regular follow-up appointments with an otolaryngologist are crucial to monitor for recurrence. This often involves periodic ear examinations and hearing tests. In some cases, a second-look surgery may be recommended to ensure complete removal of the cholesteatoma. Unfortunately, there is no known way to prevent congenital cholesteatoma, as it arises from developmental factors. Since it's not caused by external factors or infections, preventive measures are not applicable. Early detection and prompt treatment are therefore the most important strategies for managing this condition. The prognosis for congenital cholesteatoma is generally good with timely diagnosis and appropriate surgical intervention. Complete removal of the cholesteatoma offers the best chance of preventing recurrence and preserving hearing. However, recurrence is possible, so long-term follow-up is essential. Recent research is focusing on improving surgical techniques to minimize recurrence rates and enhance hearing outcomes. Scientists are also investigating the genetic and molecular mechanisms underlying cholesteatoma formation, which could potentially lead to new treatment strategies in the future. The field is constantly evolving, with ongoing research aimed at improving the lives of individuals affected by this condition.